To talk to us about schizophrenia, and then we'll have a discussion about it, and I expect it to be really interesting because few things are more interesting than schizophrenia, so off we go.
Alrighty, so I hope you guys enjoyed reading the article. Hopefully I can kind of clarify some confusion. I know it could be a little bit confusing. So what is schizophrenia? So according to DSM-5, you have to have 2 of the 5 symptoms, and at least one symptom must be either a delusion, a hallucination, or disorganized speech. And so with these patients, they also have a thing called positive and negative symptoms. And positive symptoms are basically just the characteristics and behaviors that are added to the person because of this disorder. And then the negative symptoms are basically what characteristics and behavior that they don't have, that normal, healthy people do have. Okay, so one of the positive symptoms is delusions, which is basically a strong held false belief. So they can have multiple different types of delusions. One is paranoid, where they think that people are out to get them. They also have delusions of reference. So basically anything in the environment, whether they're watching TV or listening to the radio, they think that it's somehow related to them and they're getting like personal messages. They also have somatic delusions, which is basically just thinking that they have a serious mental, physical illness, and then also that something might be like growing inside of their body. And then delusions of grandeur, which is basically thinking they have like power, like special powers or abilities, or thinking that they're like famous. Another positive symptom is hallucinations, and the auditory hallucinations are the most common in people with schizophrenia. They also have disorganized speech, which is basically just rambling incoherently. The conversation, there's completely, it's called word salads, and they're just, it doesn't even make sense what they're saying. Grossly disorganized behavior or catatonic behavior is another positive symptom. And that is basically when they might be really inactive or they might be really manic and hyperactive. They also could be rigid in their muscles and like stay in a position for a long period of time without moving. And they also can have childlike silliness or unpredictable anger, so kind of mood swings. And some negative symptoms are affective flattening, alogia, abolition, and anhedonia. So alogia is poverty of speech. So when they're having a conversation, they won't like elaborate. They'll just have very short responses. Affective flattening is basically the reduction of intensity of emotion, and they don't have very a lot of emotional expression in their face. Abolition is the inability to initiate and persist in goal-directed behavior, and they'll just be easily distracted. And anhedonia is the inability to experience pleasure or the things that they used to like to do. And it's also shown to occur in late adolescence, and it's more common in men, and it affects 1% of the general population. So it's
on the other hand, that's 1 out of 100. How many people are in here? 30?
That's true.
Is anybody schizophrenic or? Okay, so if we looked at all the classes that are going on here right now in this building, there's got to be at least one. So think about that. I mean, it's rare, but still, that's not that rare.
So what causes schizophrenia? So it's believed to be a combination of genetics, brain chemistry, and environmental factors. So with regard to genetics, there's no single gene that causes schizophrenia. People with this disorder have a higher rate of genetic mutations. And some environmental factors include birth complications, malnutrition, and or being exposed to a virus, especially when the mother, like during pregnancy. Increased immune system activation from inflammation or autoimmune diseases. Life stressors such as childhood trauma or abuse or loss of a loved one or something traumatic. And abuse of mind-altering drugs.
Uh-oh.
And also, stressful or risky life events may trigger the onset of schizophrenia if someone has a genetic predisposition for it. So, some more causal or risk factors include differences in brain structure and function. So they have smaller frontal lobes and prefrontal cortex issues, which correlates to their cognitive and motor deficits. They have larger ventricles, which is probably due to the decreased amount of gray matter that they have. And they have abnormalities with dopamine, glutamate, and GABA neurotransmitters. So they have an overactivity of dopamine synapses, which cause their positive symptoms. They have reduced GABA synthesis, which is associated with poor working memory. And they have abnormalities with glutamate and its receptors. And so abnormalities with these three neurotransmitters inputs to the prefrontal cortex lead to disruption in the circuitry and the networks with prefrontal involvement, and then that can contribute to their cognitive deficits. Okay, so past research on brain differences in these people. So a core feature of schizophrenia is that they have an overall decreased connectivity in their brain, with the exception of some areas. Patients are shown to have abnormal organization and integrity of several white matter tracts of the brain, but conflicting results on which tracts are affected. So some studies have found the anterior region differences, some studies have found posterior region differences, and some studies found no differences. And also MRI studies show decreased gray matter in volumes in people with schizophrenia, but also increased gray matter volumes in some subcortical regions have also been reported. So you might be wondering, why is there such discrepancies in these results? So it could be due to the heterogeneity of the participants and also different magnetic resonance imaging used. And also the potential medication effects, and that goes along with the heterogeneity of the participants. So some studies may have included medicated and non-medicated schizophrenic people in the same study and not taken the effects of the medication into account as far as how that affects their brain. So this study is helpful because it controls for the fact that antipsychotic drugs can cause brain changes. So we are looking at damage from schizophrenia alone. Okay, so they ruled out many potential confounding variables with the participants with a lot of inclusion criteria. So they had to have a lack of exposure to other classes of psychopharmacologic agents for more than 2 consecutive weeks, no history of seizures and head trauma with loss of consciousness, no associated major medical conditions, IQ score of higher than 75, no other causes of focal diffuse brain damage or diffuse brain damage, no other comorbidities with other mental disorders, and it would have to be their first time seeing a psychiatrist. So it's important to understand some of the things that they talked about in order to understand the hypotheses. So with this study, they wanted to assess the connectivity of the brain by using the DTI. And so if you guys remember, that measures or detects movements of water molecules in the axon so that it can map it out. And so they use fractional anisotropy, which is the value that describes the degree of anisotropy or movement of water constrained in axons of the diffusion process. And anisotropy is basically showing that diffusion of water occurs only along one direction, and it's equally restricted in all other directions. So it's just looking at the axons. And so therefore it measures axon or brain connectivity by reflecting fiber density, axon diameter, and myelination in white matter. And so with higher fractional anisotropy scores, the higher connectivity the brain has. So does that make sense?
More axons,
Yeah.
because it can only go
In one
direction. So if it were not an axon, it would be able to move around more randomly.
Okay. So mean diffusivity is basically the rate of the water diffusion or spreading of the water. So lower values mean low diffusivity or spreading of water molecules. And this is because the more membranes or the axons and cell bodies in a particular area, the more that those things are interfering with the water movement in that area. And so therefore, low mean diffusivity indicates more axons or cell bodies because it's constrained in that area.
Does everybody get that? It's kind of weird, so
Does that make sense?
basically, go ahead.
So I just don't really understand the difference between that and the fractional anisotropy or anisotropy.
So this is the mean diffusivity is the rate of water diffusion, and then the fractional anisotropy is just measuring how the water is going in one direction and that value. So it's measuring the axons.
But it seems like the way I'm understanding it, it seems like both of them are measuring the same like axon activity. No.
They are, it's just different.
Does the first one, does that kind of measure that there are axons, and then this one measures the rate that the diffusion is going at in the axons?
But it's not just axons, it's also like in cell bodies in gray matter. So,
okay. So mean diffusivity is kind of like more generalized,
Yeah.
and then the fractional anisotropy or whatever is more just the axons.
yeah.
Okay.
And so mean diffusivity too, if it helps to clarify, I have a next slide that will kind of help. But it's higher in cerebral spinal fluid, which makes sense because it's not constrained in anything, it's just free flowing in the CSF. So to kind of further clarify, so the fractional anisotropy, it's lower in gray matter, higher in white matter, lower in CSF, high in high myelination, high in dense axonal packing, white matter maturation, low in axonal degeneration, and demyelination. So basically that just shows again that it's just measuring the axons in the white matter.
Can I add something?
Yeah.
So basically, anisotropy is, well, what DTI does is it looks at the movement of water molecules. And if the water molecules are able to move randomly in any direction like they would be in cerebrospinal fluid, you would have something that's called isotropy. So iso means same. So if I say this is isomorphic with that, I basically am saying this is the same as that. So what isotropy means is that the water molecules can move the same in all directions. So they can just randomly move around any way they want if you have pure isotropy. The opposite of that is a or an isotropy. So a, when you put an a in front of something, it means not, right? So if you have apnea, that means you have apnea, which means I can't breathe. Okay. as opposed to pnea, which is I can breathe. So anisotropy is the opposite of isotropy. It's sort of like, instead of being able to move randomly, the molecules are not able to move randomly. They can move in certain ways, but not in other ways. So if you're just scanning the brain, the whole brain, what you see is that in some areas there's very high fractional anisotropy, because in those areas the water molecules are very constrained to move only in certain directions. And those then are correspond with axons, which are white matter. And when there's low anisotropy, that means that the water molecules can move in multiple different directions, but it doesn't say anything about how far they can move or how fast they can move, right? That's where the mean diffusivity comes in. If they're moving in all directions, but there's still a million membranes in there because you've got a lot of cell bodies, they can't move very fast because they have to go through all these membranes. They might still be going every direction, but just not very fast. Same way if you have high fractional anisotropy, so you're talking about axons, they can't move very fast sideways. In fact, they can't move at all sideways, but they can still move more or less rapidly in the axons, which is kind of what Nick was saying. So it's telling you, if you have high FA, it's saying, okay, we probably have something that's constraining direction of movement, which is probably going to be axons versus cell bodies. And if it's high diffusivity, it means there aren't very many cell bodies or axons in there because there aren't very many membranes slowing everything down. So it's kind of two sort of similar things that are telling you about the actual structure in there. And it's really hard to understand from reading about it. So that's why I stuck my face in.
Oh, good explanation. Thank you. Okay. So the aim of the study was to investigate whether volumetric or gray matter and DTI changes in fractional anisotropy and mean diffusivity are present in these patients. And also to explore whether these brain structural changes are associated with the duration of untreated psychosis, which is the length of time before they went to see a psychiatrist. So DUP, just remember that that means that it's the interval between the onset of schizophrenia and the first time that they saw a psychiatrist.
Do they know what the acronym means?
I like blanks. Duration of untreated psychosis. Yeah. So the hypotheses. Antipsychotic drug-naive patients with schizophrenia show white matter changes in cortical and subcortical connection systems in both increased and decreased diffusion, and such white matter changes reflect the duration of untreated psychosis and the severity of clinical symptoms, either positive or negative symptoms. And also they thought that the patients with schizophrenia in early stage of disease have gray matter volume loss in regions related to visual and episodic memory recall processing. So those include the occipital, temporal, and parietal lobes. Okay, so for the methods, they had 43 patients with schizophrenia and 17 matched controls. And they used MRI by using the T1 weighted imaging technique, which basically highlights tissues with high fat content, like the white matter, and then that appears bright, and compartments filled with water, or CSF, appears dark. And DTI scans again detects the water movement that highlights the axon pathways and connections. And so for the analyses, they use voxel-based morphology to assess the gray matter volume differences. And they also use tract-based spatial statistics to perform multi-subject DTI analysis and assess white matter damage.
So I'm going to add something else about voxel-based morphology. Basically, a voxel is a three-dimensional pixel. So what they do when they're doing MRI, and I only learned this at the beginning of the semester because I found this website that explained it in a way that was dumb enough for me to actually finally understand it after, I don't know, 10 years. They basically look at each three-dimensional space within the brain, and of course there are trillions or billions or millions of them because they're very small, and they determine what's in there, and then they add all that up in this amazingly complex way. So they're actually measuring the thickness of the cortex and getting a real estimate of the volume of cortex and other cell body areas like the amygdala. So it's really very specific and very accurate.
So they also tested the relationships between MRI and DTI imaging measures and clinical features. And so they did this by assessing the duration of untreated psychosis, which again, period of time between age of onset and first psychiatric contact. And then the positive and negative syndrome scales assess the severity of their positive and negative symptoms. Okay, so for the results, they found white matter differences. So patients with schizophrenia showed white matter differences in both higher and lower diffusion of the following networks. So that includes the limbic system, the interhemispheric connections, the cortical systems or white matter connections, the motor system, and the cerebello-thalamo-cortical circuit. So all of those areas are playing a role in these symptoms of schizophrenia. Okay. So this picture kind of shows that. So the decreased mean diffusivity is in the green, increased mean diffusivity is in the blue, decreased fractional anisotropy is in the red, and increased fractional anisotropy is in the yellow.
So then the red, so what is that saying about the number of axons, let's say maybe in the corpus callosum there, and the minus 21, which is third from the right. So if you look at that, you can see that there's red going across the corpus callosum there. What is that saying? More axons?
It's actually less.
Decreased FA?
Yeah.
So that means
Less connectivity.
less connectivity because decreased FA means increased A. Okay? So increased anisotropy. I'm sorry, I said A, I meant I. What a dork. Okay, so decreased anisotropy. No, I was right in the first place. Decreased anisotropy means increased isotropy, which means more spreading in all directions, which means fewer axons. Okay, so the corpus callosums are depleted in some way, along with all those other things that we don't know that much about. We don't, other people do. So then in what areas there's increased connectivity? All the yellow spots. So do they talk about, let's see, is there one thing there that we can kind of recognize? I can't see the one on the far.
The brainstem.
Oh, I know the brainstem. That one's obvious. So they're basically saying they have more axons going to and from the brainstem compared to the normal controls.
So for the gray matter, thought this was really interesting results too. They found mainly reduced gray matter in the posterior brain areas. And so the reduced volumes in the temporal, parietal, occipital, and cerebellum. So these specific areas of loss of gray matter contribute to the positive and negative symptoms of schizophrenia. So they found loss in the fusiform gyrus, which if you guys remember, that's in facial recognition, and also that has to deal with empathy and recognizing emotions and things like that. The posterior cerebellum, they found an association with negative symptoms and mood and behavioral dysregulation with decreased gray matter in that area. I don't know how to say that, precuneus, which is associated with delusions. The superior occipital region, which is altered perceptions, and the middle temporal lobe, which could be auditory hallucinations.
Do you know, or did it say how much, like, is it reduced volume, like how much reduced, like?
It said up to 20%.
Really?
Yeah. Yeah.
It's a lot. Yeah.
Yeah. And so no region of increased gray matter volume was found.
So that basically means their cell bodies are dying, going away, or not there, or something.
And so the red areas down below indicate like the 20%.
That's get better at reading these things. That looks like the temporal lobe there on -7, but I don't really know how far up or down that is because I'm just not good enough at reading them.
It said middle, but
So can anybody tell me what plane the left side is? The ones on the left side are from which plane? The sagittal plane, and draw a line on your head to indicate that. Great. So at least you know that. I'm very pleased. That's excellent. Okay, so what are the two middle ones? The two middle ones. So, okay, so you already said sagittal, and when you said horizontal, I just looked at you. So, coronal, yes, excellent. So, it's like a meatloaf, okay? Think of your head as being like a bread.
Okay.
And then, so what are the ones on the right? Right, so that's like,
So which one is the healthy again, and which one is the patient?
this is
Or
a
does it show?
subtraction.
Okay.
yeah.
So that's basically showing us, I don't know what the top one is versus the bottom one because I wasn't listening very well. Could you?
That one, I was kind of confused about also, but I know that the bottom one is with because I don't know what the scale from 0 to 4 actually.
Yeah, I don't remember either.
It says that one denotes T values.
Oh,
and then the
of
bottom
course.
one
Okay.
is percentage of GSH.
Okay, so what that's basically, the top one is a heat map for significance levels. So it's basically telling you, so if you look at the very middle one, -54, down below, it's showing that there's about a middle, like 10% or maybe 8 or some percent difference because the color is kind of bluish green. And then if you look up above, it's showing that that's, although it may be not that strong of a difference, it's a very highly significant difference. So we can be clear that it's real. It may not be very big, but it is real. Whereas notice that around the yellow, you see the red. So that's basically saying in those voxels, the difference wasn't as significant, and that's probably just because, again, you know, you've got variability among brains, and when you average everything together, and You know, so the middle of something is going to be a really strong, yes, that is different, but then the edges are going to be slightly different for everybody, so it doesn't come out to be as significant of a difference because there's more variability there. So, okay, that's actually a good thing to know if you ever look at any of these pictures again, and I know you will. I know you're all going to be reading this stuff in the bathroom from now on. Continue.
So for the results, so they did a correlational analysis to assess the duration of untreated psychosis and how that relates to gray matter and white matter differences in these patients, and also the severity of their positive and negative symptoms. So with the duration of untreated psychosis, they found a negative relationship between DUP and MD in several brain regions. They found a positive relationship between DUP and FA values in several brain regions, and no relationship between DUP and gray matter volume differences because they did not report anything on that. Okay, so for the DUP and mean diffusivity values, so as you can see from the chart, the longer the person waited to get treatment, the lower their mean diffusivity was in certain brain areas. So I just wanted to ask you guys, what does that say about brain structure in those areas? What could that mean?
So the mean diffusivity is lower, right? When they had waited a long time. By the way, do you know what unit the DUP is in? Is that years or months, or do you know? I can't remember.
I don't think it said.
That's kind of weird. I hope it's not years. Catherine?
I guess I'm still trying to grasp the concept of mean diffusivity, but would it mean that they have less functioning in those areas because they don't have as much, they're more constricted?
Yeah, well, yeah, so there's more like membranes in that area, so it could be increased axons or increased gray matter.
Cell bodies. Number of cell bodies in a particular area. So that seems to be saying that people who didn't wait very long still had, and this can't be in the gray matter, well, it could be actually. So people who waited a long time still had a lot of cell bodies there, but then people who went in quickly, so that seems to be suggesting that something is building up over time.
Or, like, is this possibly the difference in mean diffusivity? Because that would make more sense.
It would.
They'd have a greater difference in mean, but it doesn't really make sense, like, you know, to me, if they would have more diffusivity.
Well, let's look and see if we can make sure about it.
It's basically like density of, right? I mean, like.
That's the best way that I can understand it.
Like the density of the gray matter, I guess, like how much.
That's kind of how I think about it.
Yeah.
But again, I'm not completely sure that's correct because although I did read quite a bit about it, it wasn't things that were written for dummies. So it required quite a lot of thought and figuring it out. So I may have figured it out incorrectly. So let's see what we can see here. It does seem like if it was really talking about the change, that there would be some sort of or the difference, there'd be a delta score or something. No, it doesn't say. All right, so let's go through this again. So if mean diffusivity means The higher it is, the more it is like cerebrospinal fluid. So what they're saying here is that people who, yeah, that really doesn't make a lot of sense to me. That seems backwards.
No, now that I think about it though, that does, because so if it's more like cerebrospinal fluid, there's fewer cells and stuff. So if mean diffusivity is higher, wait.
Yeah, exactly.
Then that means there's less going on.
Yeah, which
So it's
seems
saying-
backwards.
So I think it must be the difference in mean diffusivity.
But they didn't say that. And, you know, honestly, this is exactly what it's like trying to read and understand this literature. This is not a flaw of how this is being done. I thought I understood this the first 4 times I read it. So don't be surprised. But everyone, keep looking. Don't just give up and stare at us. All right, so it must be that it's only in white matter. That's the only thing I can figure. Because if you have high mean diffusivity in white matter, that means that you have fewer axons in there.
Well, it does say that they observed the brain of patients with schizophrenia and characterized with the coexistence of white matter microstructural changes and reduced gray matter volumes.
Right.
So is that what they're talking about?
Well, if they're talking about white matter here, what they'd be saying is that people who had schizophrenia for a long time had more connectivity in whatever areas they're looking at here, which is associated with more symptoms.
Yeah. And I kind of explain that in the next one.
Well, let's look at the next one. Maybe that'll help us understand this. 'Cause I feel like I understand this FA thing. That I have fairly well in my mind what that means. So, all right, so what are they saying about that?
So the longer the person waits to go get treatment, the higher fractional anisotropy they have, which means the more connectivity, specifically in the fronto-occipital and temporolimbic tracts. So that would contribute to the auditory hallucinations and other positive symptoms that they experience.
Did they report anywhere in there a correlation between mean diffusivity and fractional anisotropy? Does anybody remember that? Do you remember? I don't remember it, but I wonder if they're just really negatively correlated. Because basically it looks like what they're saying is there weren't very many people. Like there was one person at the 40 mark, whatever 40 is. So if we go back to the previous one, there's one person up there, so that's the same person. And that's saying that same person had low mean diffusivity and high FA. So there's sort of like, looks like there's almost an inverse relationship between the two things. So
It does say that.
yeah, okay.
Yeah.
So I think it must be in this case another way of talking about the tracts, not the gray matter. And that's why it seemed confusing to us.
Okay. So with this, they looked at the severity of the positive and negative symptoms and the mean diffusivity. So the more severe positive symptoms that they had, the less mean diffusivity that they had. And so like you were saying, there is probably just a negative correlation between the two because higher severity of positive symptoms are related to lower mean diffusivity in the cerebellar and cerebral region. And that may contribute to deficits in motor control and disorganized speech. And so this suggests that the longer a person waits to get treatment, the higher fractional anisotropy and lower mean diffusivity a person will have in certain areas of the brain, and that will heighten the severity of positive symptoms.
So it's like too much, everything's connected and it's unregulated in some way.
Okay, so on for the discussion. So for the main findings with the gray matter, reduced gray matter volumes in certain areas of the temporal, parietal, occipital cortices, and the cerebellum are related to positive and negative symptoms found in schizophrenia. And with the main findings with white matter, increased fractional anisotropy and decreased mean diffusivity in the brainstem, the cerebellum, the interhemispheric and cortical white matter connections, and anterior and posterior limb of the internal capsule reflects structural hyperconnectivity in these areas. And so an example of this would be patients are shown to hear conversing hallucinations when they have increased fractional anisotropy in the interhemispheric auditory fibers. So there's definitely an association between hyperconnectivity and positive symptoms, as we saw from the correlational analyses.
What is that? You said conversing. Could you repeat that?
So patients are shown to hear conversing hallucinations.
So they hear people talking to each other?
I think so.
Wow. That's even more crazy.
Yeah. And then findings from the correlational analysis with DUP suggest that white matter changes are present before treatment begins and are associated with the manifestation of positive symptoms. So that is like the like how you can spot when someone might be schizophrenic. And so you might be wondering, where was the hypoconnectivity, or like the less connectivity in the brain? So they found decreased fractional anisotropy in the corpus callosum, the thalamic radiations, and the superior longitudinal fasciculus. And the thalamic radiations and the superior longitudinal fasciculus are basically connections that go to the prefrontal cortex from different areas in the brain. So this might be because they have microstructural abnormalities of the myelin and the oligodendrocytes that may explain these results. And hypoconnectivity in the frontal lobes may cause cognitive and motor deficits. And that is